Hi there, I'm Mike Hurst. Thank you for joining me on this presentation. We'll be talking about mental health, education and touching on recruitment, but particularly focusing on frontline security. It's not about me, but here's a bit of background to say where I'm coming from and how I got to where I am today. I've been in security for about 30 years. I'm speaking to you here today on behalf of the International Foundation for Protection Officers, IFPO, where I'm a board director globally. I'm also director of HCA Consult, where we do executive recruitment and consultancy. I'm on the board of the Security Commonwealth in the UK. And part of the reason I'm here today is because I got involved with a mental health charity for veterans called PTSD Resolution probably 8-9 years ago. And that's helped me with the understanding of these issues, and it's really brought me here today. I was also a director of the Security Institute and vice chair of the ACES UK chapter, but that was a couple of years ago now. But again, it's all part of the picture. So the security sector, you'll see from this, and this continued growth, apart from the last couple of years where pandemic related, I think we'll probably see a slight dip, there's been an increase. And so we've got the situation where over half the world, half the population of the world live in countries where there is more private security than police officers. Now, striking really, because it's not to say what you'd expect, but more and more over the years, the transference of policing from the public to the private sector has been going on for various reasons. We'll talk about it today, but it is happening, and it just stresses the importance that private security and frontline security has to us all. The Security Industry Authority, who are the regulator in the UK, had their Safer Nights Out campaign a couple of years ago. In that, it showed 70% of staff had been assaulted at work. 34%, just over a third, hospitalised, and again, getting on for half, have been assaulted with a weapon. Now, these are physical assaults, but the links between physical assault and mental health and well-being are fairly clear, and hopefully we can demonstrate that as we move on. It was a survey by a group called Working the Doors over here in the UK, and who mainly focus on that door supervisor position, bouncers as we used to call them, but door supervisors is the correct term. A third of these people are being assaulted monthly. Half of them, so every time, assaulted, verbal or mental, verbal or physical assault is, and over half say their mental health has been affected afterwards, and over 3/4 are saying it's getting worse. Now, COVID and the pandemic has made things worse still. The ONS figures show that the death rate amongst frontline security officers is incredibly, one of the highest, and it's higher than most of the medical professions in percentage terms. Absolute numbers are different. But so if you think about it, you're getting assaulted, you're getting abused, you're under a threat of attack, you're under a threat of catching and dying of COVID, all these things which are physical threats, physical issues, but they build towards making your mental health and your well-being worse. Mind, the mental health charity, lists several causes of mental health issues: discrimination and stigma, severe long-term stress, drug, alcohol misuse, self-medication, all these can be stress-related, trauma, such as being in the military or the police, things you experience there, and that PTSD issue we mentioned beforehand. Being involved in a serious incident where you fear for your life, or a physical injury. So all these things is all physical incidents, but they can affect your mental health, particularly as they build up over a period of time. There was an academic survey a couple of years ago by some people based from the University of Portsmouth, and I'll leave you to read the title because it's quite a long one, but almost 40% of security operatives surveyed are suffering stress and PTSD. 40%. That's a huge number. And what is some ways more shocking really is that 57% say that the organisation they work for has no mental health and wellbeing training or support, and only less than a third of the managers have been trained to recognise these signs. Now, this is 2 years ago, and I think over the last couple of years we would have seen an increase, but probably not that much. Some examples, these are real life examples that obviously have been anonymised, but we had a hospital security officer who was stabbed with a hypodermic. Now, as it turns out, they were fine. There was no long-term, medium-term physical harm done to them. But you can imagine being stabbed with a hypodermic in a hospital. They didn't know what they might have been affected with. It could have been life-threatening, it could be life-ending. It wasn't, but the stress built up waiting for the test to happen and afterwards was really shocking. There was a suicide attempt. An officer found someone in the process of hanging themselves, and they had to get in there and support their weight for quite a while until colleagues were able to come along and release the person and ultimately get them down. Now, one, there was a physical attempt, physical exertion, having to support their weight while they did this, but also the fear of failure, the fear of letting them go and them ending up, killing themselves. Which, another one, suicide attempt. They couldn't find the person in time. When they found that it was too late, the person was gone. They tried CPR, it's too late. So all these things, well, the stress, well, if we'd got the sooner, if we'd gone left rather than right, what could we have done? Builds up to it. Happened last autumn. A couple of officers were stabbed. They actually stabbed protecting a police officer. And their colleagues, some of whom weren't on shift at the time, weren't even working, felt incredibly guilty because they weren't there to help. They felt, well, if we'd have been there, we could have helped. So, they probably couldn't have done, but that's not the point now. It's all these examples of issues that can cause damage. So there's good practice. One was, again, a couple of years ago, Starbucks in the US. They were providing all their US staff and their family access to mental health and wellbeing sessions, so with a trained therapist, just to, because again, you think, okay, this wasn't the same security, but these people are customer facing and customers, this kind of thing. So having that resource was really useful. The Small Talk Save Lives campaign through Network Rail. They've got 23,000 employers, stakeholders trained in suicide prevention techniques. We've come across lots of instances where people have been dragging people off railway tracks, trains approaching, pulling people over car park roofs. It's really shocking. Johnson & Johnson, huge company, they now employ mental health ambassadors and have a good number of their people trained in mental health first aid. Very important. Deloitte partnered with a third party to produce some stress mitigation and resilience techniques. And there's the TRIM systems used by UK Police, the Health Service and other organisations as well. So these are some examples, not the only examples, but a few that have shown to work. So it's about about solutions, not problems. So what can you do to support staff? Well, I think you can start by treating people as people, not just as symptoms, not just as a problem to deal with. This is a person. How can we support this person? Mental health awareness training. So being aware of the signs, what to look out for. How can we, help? What do we do when we do find these symptoms? We do become aware of these situations. Mental health first aid training. Well, having a number of your people trained to look after people. Now, it's not the same as a physical first aid whereby you're sort of sticking a tourniquet or doing CPR, but it's a term people use and understand. So having that sort of formal training, formal qualifications, really important. Peer support. So there's people can talk to their colleagues in confidence, knowing that there's someone there to listen to them and perhaps do something about it. People who are in need, offer them some resources. access to counselling, mental health champions you mentioned down the line, and things like equity, diversity, inclusion. Now, some of the stigma and issues we mentioned beforehand that could come from not having a very diverse or a very tolerant workforce. So if people feel that they are accepted for themselves, irrespective of what they are, who they are, their mental health problems, their religion, their race, whatever else is, gender, all these things build a happier, healthier workplace. Now, we touched on training. Now, there's lots of good courses out there by lots of people, but there's a couple that we've developed to help people. The Being Human program, which we've developed with a company called Ethos Farm. Again, you pick your avatar, click through, people talking to you to help go through it, and it's about recognizing the signs, what to do, because security officers are first responders. You're often the first point of contact, you're the first person someone sees, and often they are out and about on a patrol, on the door, talking to people. So having this awareness is really important. We've also developed a very big e-learning platform that we're rolling out more courses on a regular basis. But we've got this program now, Understanding Mental Health and Wellbeing. It's built by security people for security people. It's accredited by Highfield, and it's available on the e-learning platform. Now, it's accredited at level 1, but we have a level 2 program about to roll out in the next few months. So we'll be progressing. There's level 3 and then level 4 planned in due course. But to get people through the process, to get them better qualified, better able to help people. So the messaging, internal messaging is important. So some of these things are a bit cliched, but important. It's okay to ask for help. It's okay to get help. It's okay not to be okay. Take care of yourself. Take these things, whether you put these things out on the notice board in the canteen, send out on the intranet, these messages just makes people know that helps give them the confidence that if there is an issue, if there is a problem, you are going to be responsive and you're going to be helpful and you're going to support them, help them get through and get the support they need. So messaging is very important. I said we touched on recruitment. Now, one of these things, we want to do the right thing for doing the right things purpose, but also it's good for business. The again, analysis by Deloitte of the UK Thriving Survey suggested a really good return of between £1.50 and £9 for every pound employers spend on mental health interventions. So it's good for people, but it's also good for business. Also, what's good for business is diversity. Diversity makes sense, it makes money. It means you can recruit from the widest selection of people available, irrespective of where they come from. And it's not just how they look or what they, it's diversity of thought. Diversity of thought is really important. If everyone comes from the same background, with the same views, you're not going to get that dialogue internal that is going to help you drive the company forward. Also, having a workforce that reflects the companies you serve is great. And reputationally, if you're seen as being a diverse, welcoming organisation, that's going to boost your reputation and make it easy to get people to come into you. And also, it's worth mentioning that discriminating on the basis of mental health and other things, race, gender, this sort of thing, is illegal. Equalities Act 2010, these things are prohibited. And with the mental health issue, if you become aware during the process that someone has a mental health issue or a disability, and you reject them on that during the process, that's also illegal. So we are talking to some industry groups about a new campaign, which we're probably rolling out in April, May time. Security Minds Matter. We've got the hashtag here. More to follow on this, but what I would say is really important, share resources, getting companies to come on board with it, but maybe follow us on Twitter @SecMindsMatter, and you'll get the updates on that. The website is to follow, but watch this space. And that's basically it. I hope you found it useful. I hope there's some snippets there that may help you in your working life. Please feel free to connect with me on Twitter or LinkedIn. The IFPO details are there as well, and HCA Consult. So please feel free to connect. And I hope you enjoyed the day, the session, and I hope you enjoy the rest of the day. Thanks very much.